Welcome to the Urban Agenda. I'm David R. Jones, President of the Community Service Society, and your host. Today we'll be looking at health issues that touch all of our lives. The selling of New York City hospitals, the forcing of Medicaid recipients into managed healthcare organizations, and of course, balancing governmental budgets through Medicaid and Medicare cuts. To help us assess the impact of changes in healthcare delivery, I have as my guest John Ronches, Executive Director of the Committee of Interns and Residents. With 6,000 members in 5 states and the District of Columbia, his organization is the nation's largest and oldest union of house staff physicians. Thank you for joining us today.
My pleasure.
Well, I'm on the board of the Health and Hospitals Corporation, and there's a fight, obviously, that's being conducted on the issue of privatization of public hospitals. Has your union taken a position, and how do you feel about all this?
We certainly have taken a position, David. The threat to all of us of the privatization of city hospitals is a matter of great concern to us. A number of your viewers will remember that last year we ran an ad campaign with posters in the subway with a bed in the street where with the headline, "We can't let this be the future of healthcare in New York City." The icon, the bed in the street, was purposely meant to suggest that there would be people left without healthcare in this city who are now taken care of by the public hospitals and who would be left out in a privatized system. We're opposed to the notion of privatizing public hospitals for that reason. We think that the government, the city government, has an obligation among its other obligations, like providing police and fire services, to provide basic health care services.
I guess the mayor, Mayor Giuliani, constantly says, well, the voluntary sector and the private sector always provide better health care. Do you accept that?
I don't think that there's a good case to be made for that, for several reasons. One of the things that the mayor frequently doesn't mention is the fact that the city now pays $500 million, that's $500 million, in payments to affiliated medical schools and private teaching hospitals to provide physician services and other medical services at the public hospitals. An example would be Bellevue and NYU. Many of the doctors who take care of patients at Bellevue are members of the faculty at NYU and also take care of private patients at NYU. So to suggest that somehow people would get better care if they were across the street, I think would require some stretching, and it hasn't been our experience, certainly.
One of the other things that's emerged, Assemblyman Ramirez up in Albany is introducing a series of bills because of what's perceived of as discriminatory practices against Medicaid patients by voluntary hospitals. Have your union looked at this issue and the question of can voluntary and private institutions provide non-discriminatory care?
We're looking closely at that issue now, and we expect to support all or certainly most of the Assemblyman's proposals. There's a long history in this city, David, as you know, of voluntary hospitals failing to provide the level of services that the communities require. For example, back in the late 70s and early 80s, there was a very common problem that we referred to then as patient dumping, where the voluntary hospitals, that is the private or not-for-profit hospitals, would refuse to provide medical care to people, sometimes who were in dire need of medical care, because they lacked insurance or the ability to pay for their medical care. Now there's a law that was sponsored by then Assemblyman Hevesy, which prohibits voluntary hospitals from refusing emergency medical care to people because of their insurance status. But there's no law now that prohibits voluntary hospitals from refusing all other levels of care to people. And in fact, they do it every day. We see them in the emergency rooms of New York City's public hospitals every day.
Have the mayor's people or anyone else indicated how they're going to overcome this discriminatory problem that voluntary seem to be suffering with?
Well, they haven't, and it's one of the sources of our concern is that there's such a long tradition of the voluntary hospitals not providing these services. It's hard to imagine how that could change dramatically overnight. And the other part of that concern is that some of the people who seem responsible for making these decisions on behalf, or these recommendations to the mayor, seem to lack basic information. For example, the law that I just told you about, which prohibits voluntary hospitals from refusing emergency care to people, has frequently been described by the mayor or people on his staff as requiring the voluntary hospitals, prohibiting them from turning away any patient. And that's just not so. So we're concerned about the level of information they have and then what conclusions they draw from that information.
Well, in terms, I think there's a sense in many communities that they are concerned about the idea of privatization. Are there alternatives that have been suggested to try to help the corporation deal with its financial distress? Does your union, for instance, come up with some alternative measures that could be taken that could avert this kind of transfer?
Well, David, you have to go back to the origins of the Health and Hospitals Corporation and look at the management structure. Right. One of the things that was clear to everyone at the time that the Health and Hospitals Corporation was created back in 1970 was that there should be a board of directors separate from the day-to-day hurly-burly of the city and separate from the city's budget structure, who would then be responsible for guiding the public hospitals system so that it would provide the services that city residents need and would do it economically and do it well. The mayor, through his appointments to the board and through ignoring the board of directors of the Health and Hospitals Corporation, has in effect relocated the center of operating the Health and Hospitals Corporation from its board of directors, who are the lawful authority, to a basement office in the City Hall. We think that one thing that should be done immediately is that the mayor should recognize and acquiesce to the statutory authority that's vested in the members of the board of directors of the Health and Hospitals Corporation and let them do their job.
Well, it's certainly been my fight as a board member to try to get us to take some stronger stands as an independent body, but I must admit the mayor's office has not been very accommodating to those notions. When we put forward a resolution even expressing concern about the Governor Pataki's Medicaid cuts that would have had a $800 million impact on the corporation, the mayoral appointees voted even that resolution down. So I think we are in serious independence issues. This is not acting like a fully independent body, certainly not in the way that the legislature, when it created the Health and Hospitals Corporation, had hoped it would act.
Well, many of your viewers will remember that not only did the mayor support the $800 million in cuts, the mayor actually traveled to Albany to plead with the governor to increase the level of cuts to over $1 billion.
Yeah, let's talk about the cuts. I mean, we're looking now, it's going to be modified somewhere, but it's going to be somewhat less than $800 million ultimately, but not that much less. And we're facing a corporation that seems to be being downsized not on a fast track, but on a super fast track. What do you think the impact in terms of care is going to be? What impact on the members of your union? I'd like to hear.
I think that it's fundamentally wrong. It's immoral to make healthcare decisions which affect millions of people in the city of New York simply based on how much it costs. There isn't rational planning or recognition of community needs or the special needs of New Yorkers anywhere in the planning that's going on, if indeed there is any planning going on by the mayor's office. Every decision that we've seen come out of City Hall since the inception of this administration has been driven by money concerns and the interest of the mayor's office in saving money out of the healthcare system. And what we need is for the Health and Hospitals Corporation Board, again, who are the lawful authority, to take the responsibility for making these decisions and to say no.
Let's talk about the most immediate crisis that's before us, the recommended privatization of 3 facilities. What is, the viewers may or may not know about this, but the mayor has recommended and has commissioned the J.P. Morgan Company to do a report talking about the feasibility of literally turning over 3 institutions to the voluntary sector, or the private sector for that matter. It has a lot of us on the board concerned. What is your reaction to that?
Well, it's an excellent example of the sort of thing that we're talking about. The mayor made a promise or a pledge during the latter stages of his campaign that he would privatize some city hospitals. Although there seems to be no rationale for doing this, they seem bent on going forward with it. The J.P. Morgan study was commissioned apparently to support a conclusion that had already been made at City Hall. And in fact, those who've read the J.P. Morgan study will note right in its first few paragraphs mentions the fact that they were directed to study only Queens Hospital Center, Elmhurst Hospital, and Coney Island Hospital. Not to study all of the 11 acute care hospitals of the HHC to decide whether it made sense to privatize any of them, and if so, which ones, or to look at the system as a whole, but instead someone whose identity remains a secret picked out 3 hospitals and told J.P. Morgan to write a study about privatizing them. We've carefully read the study, and I think if any of your viewers care to go through it, we'd be glad to give them a copy of it. But it's notable, the study is, because it talks about money and how much the city does or may spend on running these 3 hospitals, and nowhere does it mention the needs of the patients that are served by those 3 institutions, or the communities, or the workers for whom those 3 institutions provide jobs, and those jobs in turn allow people to feed their families and keep the unemployment and welfare rolls down that the mayor seems so very concerned about.
I think, in addition, a number of board members have expressed concern that nowhere, at no time, does there appear to be an effort by the administration to have a public discussion of the J.P. Morgan or the privatization issue at all. As a matter of fact, we have asked, as board members, that we have a public hearing at an HHC board meeting to have full public disclosure of what's going on here. And each time those resolutions are submitted, they're voted down by the administration appointees. Well,
we made the educating the public a priority in our campaign last year that I referred to, that included the TV ads and the subway posters. And we were harshly criticized by Maria Mitchell, who's the mayor's chief health policy architect and now chairman of the board of directors of the Health and Hospitals Corporation, who said that our campaign was premature and that we were trying to frighten people, and that at the appropriate time there would be a discussion, a public discussion, about privatizing the city's hospitals. It seems to us that now, in looking over what's happened since then, that we were right to begin to educate people. We were right to express a level of alarm that things would be done in the back room instead of out front where we could see it. And in fact, that the long-promised public discussion about the utility or the good sense of privatizing public hospitals isn't going to happen. They've made up their minds, and they don't care what the facts are, and they don't care what people think.
I'm wondering, trying to take this to some of our viewers who don't know the intricacies of the Health and Hospitals Corporation, but who use municipal facilities, what might they see if things go wrong here? For instance, if I use Kings County or I use Bellevue, and I'm either a Medicaid patient or perhaps I'm uninsured, and I basically have to make use of some emergency or just services for a sick child. What impact would there be in your view?
Well, for those of your viewers who've been taken care of in a private hospital, you know that when you go there, there's a great deal of attention paid to your insurance status. People want to know, they want to see your insurance card, they want to know what company carries your insurance. They sometimes want to get on the phone and make sure that you have insurance before they admit you or take care of you. And it's important to their financial bottom line to be able to do that. In the city hospitals, they'll get around to that eventually, asking you about your insurance status, and if you have insurance, they'll get it. But the first question isn't where do you have your insurance. The first question is where does it hurt? And then there's an effort made to provide medical services to people based on their need. And their insurance status is somewhat further down the list of priorities. Everyone should be concerned that a privatized hospital system in New York City would behave much like it does now, and that is that people who are not insured or who are underinsured, and we have many people in the city who work 2 and 3 jobs who have no medical insurance, that those people will just be shut out from the system.
Couldn't there actually be dangers for the voluntary sector if too rapid privatization goes on, or the elimination of Health and Hospitals Corporation goes forward? Are there any risks for the voluntary sector as well here?
Well, the Health and Hospitals Corporation took care of more than 1 million patients last year, and it's hard to imagine that the private sector could simply absorb that number of patients in a short period of time without substantial dislocation, not just to the people who are taken care of in the public hospitals, but the people who are now served by the private hospitals. If everyone is rushing to the door of the private hospital, not only will decisions have to be made about who gets in and who gets care, but people will find that it's rationed on both sides of the street.
The other concern I've heard is among voluntaries who will, if there are any mandates here as these transfers take place, will have to accept uninsured patients. And with the squeeze going on, both on Medicaid, of course, and on the bad debt and charity pool, which covers where hospitals can't get any money from anybody else, that they could end up in with real financial issues as well if HHC disappears.
Well, we can expect that that would be the case, at least in some hospitals. In others, we expect that they would do their best to avoid compliance with a mandate of that sort. And then finally, we'd say that in any case, the city is obligated under under Medicaid laws and under some other city obligations to pay for medical care for people who don't have insurance. And in New York State, the city pays 25% of the Medicaid tab, unlike the situation in most other states where it's a state responsibility as opposed to local government. If the city transfers the obligation to take care of uninsured patients from the city's hospitals to the voluntary hospitals, it hasn't relieved itself of the obligation to pay for those people. They've simply put them in a place where it's going to cost more to do that. Right. And so that privatizing some of the hospitals, or any of them, may have exactly the opposite effect of that the mayor intends, which is to save the city some money.
Let's talk about something else that's really reshaping medical provision, which is the notion of putting all Medicaid patients into managed care plans, into HMOs. What is your attitude towards that? What are the pitfalls with that kind of rapid enrollment process that's underway at the state?
Well, there's several concerns. Let me say, first of all, that the notion of managed care is not inherently bad, and in fact, it has some good aspects to it. At least in the early stages, we can be reasonably assured that some people who now lack access to primary care services will be able to get it, at least to some degree, in a managed care system. But the concerns are that in the way that managed care is moving ahead so quickly, there will be many people who won't be able to get those services. The idea is that the idea of managed care is you take people out of the hospital environment and you try and take care of them in a community setting, and you try and do things that make sense to all of us in the way of inoculations for children and preventive care. We don't have that capacity in New York City right now. The doctors are primarily associated with hospitals, and doctors who now take care of private patients, many of them aren't willing to relocate to neighborhoods that are served by HHC hospitals. And we lack the primary care capacity to take care of these people. It would be much like a few years ago when there was a great idea about deinstitutionalizing the mentally ill, and everyone said, we have this really great system for taking care of people. We have this great idea about how we will do it. We're going to take them out of state hospitals and we're going to treat them in neighborhood settings where we can do it much more cheaply and more effectively for the patients. And so we took everyone out of the state hospitals and deinstitutionalized them. And we didn't build the capacity to take care of them in the community settings. And what we did was not only bad for the care of those patients who were taken care of in state hospitals, it's badly exacerbated the homeless problem in New York City. And shifted costs that the state used to pay for to the city, because now the city hospitalizes many of these patients.
In confirmation of what you're saying, my organization, the Community Service Society, I guess, did the last study looking at the poorest communities in the city of New York in terms of the access to primary care physicians. And we got a long state list saying there were more than 1,000 serving the 9 poorest neighborhoods. When we sent teams out to knock on their doors. This was 3.5 years ago, a little out of date. But what we boiled it down to, after we had done a survey on each of these physicians, is that only 38 of the little over 1,000 would meet minimal federal guidelines for primary care delivery. And most of the cutoff was they wouldn't accept Medicaid, they were aging out, they didn't have 24-hour coverage, they didn't have any association with a local hospital. I mean, it started to look like the capacity issue we're talking about here is even worse than people imagine in terms of the availability in very poor neighborhoods of primary care physicians.
Well, there's no doubt that capacity is missing now, and that's a real and urgent problem now. And it's even forced the governor to scale back his plans to force all state Medicaid patients into managed care programs. The other concern about managed care, David, is longer, in the longer term. Right now, the rates for that the state pays for Medicaid managed care patients are set at the relatively reasonable levels. No one will get rich taking care of those patients, but it won't cost doctors money to take care of them, and it won't cost hospitals money. They'll be able to offset their expenses. But what happens when everyone's in managed care, and then the state reduces the rate that they pay for managed care, much like they do for Medicaid, or the cost of taking care of patients far outpaces the state's ability to raise their payments to take care of managed care patients. And here we talk about not just Medicaid patients, because many employers in New York City and in New York State have enrolled their employees in managed care programs. What happens when the costs of taking care of those patients don't meet the ability to pay? The system will have to force patients out of it. They'll have to, the only way, if you can't get more money in, the only way you can make it profitable is to provide less care. And it seems to us that once people are in that system, that it's a one-way road, and there isn't a road back if we've made a mistake, and we should do it much more carefully.
The fact that your union represents more than just the state, there have been some other state experiments with forced enrollment that have had some rather disturbing results. I've obviously heard about some situations in Florida and other parts of the nation where managed care enrollment of Medicaid was forced, and abuses began to crop up immediately. Have your members and yourself heard about some of these problems?
We have some of the ones that you know about, David, and other problems in California with Medi-Cal managed care. And then in some of those instances, in California particularly, patients seem to have just disappeared from the system. The numbers have changed so radically that it's impossible to conclude anything other than large numbers of people have simply been excluded from getting health care in the managed care system. I know that there are organizations there that are now looking at the causes of that and what's happened, but we, at least at this point, we're able to know that people have simply been excluded.
One of the things my programs tend to be a little gloomy at this point, to say the least. And I'm trying in the end to as I talk to my guests, to talk about what should people do about this. It's unacceptable to hear some of the problems that you've articulated and some of the concerns without telling people what they have the power to do something about.
Well, let me say, I don't want to focus just on problems.
Right.
We have a great healthcare system in New York City. It's among the best in the country, if not the best. And the New York City Health and Hospitals Corporation, which runs 11 acute care hospitals and a whole series of neighborhood family healthcare centers and clinics, is exactly the sort of thing that everyone else in the healthcare industry is trying to build. That's why we see hospitals buying other hospitals and going into joint ventures together. It's because big is now better in the healthcare industry. New York City already has that, and some people are now trying to take it in the other direction by taking it apart. We think it's basically an excellent system for providing health care for people in New York City, and it needs to be strengthened, and it needs to be valued, not ignored, and certainly not defunded. And we think it's a real positive in New York City.
We're on the board somewhat concerned when the incredible work done at Goldwater Memorial on long-term care for people with severe disabilities, or at Bellevue, or throughout the system, where we get rated well into the top institutions of the nation, just aren't reflected. It's not talked about. And one of our complaints, obviously, with City Hall, they never seem to point out when the corporation hits a home run. So I think it's a joint concern here.
Well, we only hear about the problems. We never hear about the successes, which are most of the cases.
Right.
The thing people can do directly, David, to express their views are to call or write or fax a letter to the mayor's office and say that they think that public hospitals should be kept public. They can also speak to their local city council representative and to their state assembly and senate representatives. If people don't have those numbers, we'd be glad to help them get them. They can call us at 1-800-CIR-8877, and we'll be glad to help them get in contact with their representatives.
Thank you very much, Mr. Ronches. There's something clearly wrong with the healthcare picture today. Instead of being driven by the need to provide competent service for the very sick, governments and institutions are being motivated to cut budgets without regard to the human cost. The United States, and indeed New York City, have medical care systems second to none. Let's not dismantle quality programs in haste and regret the results at our leisure. This is David R. Jones for the Urban Agenda. Those interested in learning about other topics on the agenda may call or write to the Community Service Society of New York for a free copy of collected newspaper columns. The number is 212-254-8900. Thank you for joining us.
To comment on the Urban Agenda or for more information on CSS, contact Community Service Society of New York, 105 East 22nd Street, New York, New York, 10010. Area code 212-254-8900.